I'm Dr. Calvin Wallace Martin Jr. I'm a urgent care physician at SIMEDHealth in Gainesville, Florida. A patient can be evaluated and treated very quickly, sometimes in under an hour, and for more complex cases, up to 2 hours. We provide quick, efficient service at a greatly reduced cost relative to emergency rooms. Though it can be frightening, commonly chest pain is not caused by a serious condition. Problems such as strains of the muscles or bones in the chest can be a cause of chest pain. Sometimes chest pain can be related to something as simple as reflux or heartburn. Of course, chest pain can be more serious, like problems with the vascular system or the lungs or the heart, in which case a rapid evaluation with blood work, EKG, chest x-ray, or other imaging can be very helpful in determining the cause. If someone has significant chest pain that is severe, particularly radiating to an arm or the jaw and associated with shortness of breath or heart racing or palpitations or nausea or vomiting, sweating, these would all be reasons to go directly to an emergency room. However, absent those conditions, a lot can be done in our urgent care center to look for a cause and decide on the best course of treatment. Abdominal pain can also be very concerning, but also frequently is not caused by anything severe. At our urgent care center, we can get accurate history and physical exam, perform urinalysis and stat blood work as indicated. Based on blood work and exam and history, we may also opt to do an ultrasound or even a CT scan. If you're not having high fever or intractable nausea, vomiting, or intractable diarrhea, frequently we can get to the bottom of the problem and treat it effectively. Again, with history and physical, a lot can be determined, but we can also do stat x-rays with reading by a radiologist to determine if there is a fracture or dislocation. You would consider going to the emergency room for a musculoskeletal injury if, for instance, there were bone protruding through the skin, but also if you can't feel the finger or hand or arm that's injured, or there's a pale discoloration suggesting some type of vascular injury. Also, inability to walk, for instance, for an ankle injury, could suggest a fracture but would not require evaluation in the emergency room. At First Care, we can order chest x-rays to look for things like pneumonia, but also frequently just with exam and history, that would not be necessary. Sometimes antibiotics are required, sometimes not, but we commonly treat ear infections, sinus infections, and all types of respiratory conditions as needed. Sometimes the respiratory condition could be just related to bronchospasm, such as things like asthma, and we can treat that acutely in the clinic and give appropriate medication to treat it to resolution.